Hi guys, welcome back to the channel. I'm sat here again with Jack Pusey, who's the showbiz editor at the Daily Star, and we are going to be talking today all about how showbiz culture and celebrity influences what people are asking for me at the clinic.
What do you think are the biggest misconceptions about cosmetic work? Are there things where you have like eye roll all the time when you hear people talk about stuff and you think, no, I do it every day, like it's nothing like that?
Well, I think the first thing is that you're always going to look done, or like you've had something done. The second is how much product it takes to create a certain look. So, you know, maybe somebody will want to just use 1 ml of filler and be very frightened that they're going to have a very augmented look in the lip. But the reality is you need to use an awful lot to get that sort of, you know, reality star look.
Yeah.
It doesn't just happen overnight. I think the second thing is how often do things go wrong, and what do you do about them? So whenever I mention to my patients, because obviously we have to go through a consent process before we do any treatments, and one of the very, very rare, unusual side effects of having a dermal filler injection is occlusion of a blood vessel, so blockage of a blood vessel, and in very, very rare circumstances, blindness. So
Scary word.
Yeah, it's terrifying. So of course, when I mention that, you know, everybody's terrified. I try then to put that into context, because last year in America there were over 2 million dermal filler injections, and we're talking about, you know, a handful of people over a 10-15 year period who have experienced this. So it's a very, very small number. Nevertheless, people do tend to get quite hung up on the potential side effects. And then I suppose my question to them would be, if this is such a terrifying concept, then why would you go somewhere and increase your risk of having a complication like that, or having somebody who can't manage that complication? Because if you're watching this from abroad, in the UK there isn't really any real regulation about who can perform these procedures, so anybody could do it. You know, you could do a course tomorrow for a day and, you know, set up Jack's shop in Canary Wharf and, you know, treat all the members of the Daily Star officers, and that would be totally fine. It's totally legal.
It's quite terrifying when you think about that.
It is. It's scary. And the fact is, there's an awful lot of stuff going on here that is not immediately visible. So it might just look as simple as, oh, there's a line there, I'm just going to fill that, or, you know, let's just put filler in to make the lip look bigger. Great. It's not quite like that, because you have to have I think quite an in-depth knowledge of what goes on underneath the hood in order to get a look that looks natural and is safe.
Anatomy is obviously really complicated, and you know, your average person, if I took a course, I'm still not going to know the ins and outs of anatomy. Big trend with celebs going abroad for surgery.
Oh, do they?
Yeah, lots of people have gone to places like Turkey to get the Brazilian bum lift, normally with body stuff rather than face, I have to say. There have been some bad results for that, because, you know, there is, for these kind of procedures now, Brazilian bum lift can't be carried out in the UK. It's not, they're deemed too risky. What do you think about people travelling abroad for surgery? Namely, you know, a lot of celebs do it, and then obviously if things come wrong, they come back and the NHS has to pick up the slack, essentially. So what are your thoughts?
I would have huge reservations about going abroad for surgery. If something goes wrong, you're quite far away from your surgeon when you come home. If you do end up in the NHS afterwards, they might not be able to understand what's happened to you, might not be able to fix the issue. I would be very sceptical about, you know, because different countries have got different ideas about what looks good. So if you go for a rhinoplasty, a nose job, for example, in Iran, you'll get a very different outcome to if you had one done, I don't know, in Paris. It will not be the same. The same thing comes from body contouring surgery, and this whole look of this you know, very augmented glutes and the
teeny little waist, big bum, big boobs.
I think it's going to go out at some point. It's not going to be here forever, in the same way that the breast implants were not here forever.
Well, it used to be the question, does my bum look big in this? The correct answer used to be no. Now it seems that the opposite's true.
I know.
You know, so tastes obviously do change.
They
I
do.
suppose the worrying thing is that people are often having permanent procedures, and, you know, which is basically following a trend, which is temporary. I mean, in line with that, it feels like we're having a bit of a renaissance of, fillers at the minute, for example. What do you see as the future for this kind of work, and how do you think that might creep into like Hollywood and celebrity culture?
Well, 100% this cookie cutter look is going out.
Yeah.
I know it's still very prevalent on Instagram at the minute, and that's how a lot of people gain their followers, is by looking the same as literally everybody else who's on there. Brunette, high cheekbones, big lips, skinny jawline.
Yeah.
It's contour, highlights, it's the same. So I think in a few years we'll actually be quite aging. It's like when you see an older lady and she's kept the same haircut that was maybe trendy years ago.
Sure.
Same thing will happen with the face. But what doesn't go out of fashion is yourself. You're never going to go out of fashion. So this concept of changing someone, I think, will go, but what will always stay is making somebody the best version possible of themselves.
And are there any kind of breakthroughs in the industry that you think, I've got a feeling this is really going to take off, or this particular procedure or this product? I mean, for example, 2017 was definitely the year of the lip. Do you think, even just looking forward to 2019, are there any procedures that stand out to you as particularly popular?
Well, I think the first thing that I would say is a new procedure doesn't always mean that it's safe. I remember a few years ago there was a very big company who brought out a product which was taken off the market within a few months because people were getting lumps formed underneath the eye. So new's not always the best.
Okay.
In terms of what look people are going for in the future, definitely I've seen a lot more people having an interest in the skin. So whereas before you could almost separate patients into, they're into injectables or they're into skincare. Now there's a big crossover between the two, and companies who have produced things like Profilo, Juvederm Volite, Restylane Vital, TSL Density 1, they're all these hydrating fillers. These things have been around for years. It's just that the public perception of them has changed, and perhaps the way in which they're marketed as well has changed, but it's not a new procedure.
Right. And we hear a lot about things like, the vampire facial, which uses your own blood, and stem cell injections into your scalp to promote hair growth, almost on people using their own fat as filler. Yeah. Do you think that kind of like bio element of things, people using basically parts of themselves in the other areas, do you think that will take off more? Do you think that will become more popular?
One of the things that stops people from doing that right now is cost, because you need to have two separate procedures in order to get that. So, like, for example, if you're going to do a fat transfer, it needs to be done in a specially designed unit, which is expensive, and also you need to have a second procedure to actually get the fat out.
Right.
So because of that, the cost will always be higher. In terms of things like using somebody else's stem cells, that's definitely a procedure which is more popular in America. So they use stem cells normally taken from umbilical cord cells, because different countries have got different rules and regulations about what is allowed in terms of stem cells on autologous blood products like platelet-rich plasma as well. Will we see more of them? Possibly, if the cost of it comes down. Because it is a biological product, it does need to be produced under these slightly more rigorous conditions. So if you're just injecting a syringe of dermal filler, it's probably safe to do it in a clean environment, not a sterile environment. But with these other products, it really does need to be done in a sterile environment, which is more expensive.
One thing that I think is definitely prevalent in the media is hearing horror stories when it comes to work that people have had done. So shows like Botched, for example, where the whole premise is, oh my lord, look at this terrible work this person's had done, let's try and save it. Whereas I imagine the work that's done well, done subtly, done in harmony with the face, probably doesn't really get the same amount of press, because firstly you might not even be able to identify it, and secondly there's not so much of a story there. So do you think perhaps historically the representation of cosmetic procedures has been slightly warped in the media because we all like a train wreck, don't we?
Totally. I mean, you never really get stories like woman looks amazing after having, I mean, unless it's a big celebrity, in which case you might do, but we all love a negative story, don't we? We all like looking at pictures of people who have maybe, gone overboard with the makeup or something like that, and, they look a complete state, because, internally we're thinking, God, I'm glad that's not me.
Yeah, we love the drama, we love the spectacle of it. And
But it doesn't have to be like that. You know, as long as you're picking somebody who is actually skilled and talented and capable of delivering a natural result, then you're good to go. But there are different types of injector out there, different types of practitioner out there. So because of the lack of regulation in the UK, as I mentioned to you before, literally anybody can start doing cosmetic injectables. There's nothing to stop you from starting doing it tomorrow. You know, when you've just done a 1-day course and you've got the certificate for it, of course that's great, but there's a whole background before that. So there's a lot of anatomical knowledge. Then of course there's the experience of having thousands of cases as well, and knowing what to do if there is a tricky situation. So not everything goes swimmingly every time that somebody has something done, and also I think that perhaps the less experienced injectors would do slightly more obvious work because you don't know what you don't know at that
the
point.
Nuances perhaps.
So there's that famous curve where it's this shape where when you first start training in something, you think you know everything and, like, you know, you're amazing, and then I think once you've been practicing for about 5 years, your level of confidence is like down here somewhere, and then after about 15 years then it goes back up again the other side. So I think if you're smart, you're down here with your level of confidence. It definitely pays to be cautious.
Yeah, a lot of dentists now offer. I remember when I went to my dentist not that long ago, they had a big sign at the front saying now doing Botox. What do you make about dentists jumping on the action? Is it just kind of there's demand, we might as well make it, you know?
Well, I think some of the best injectors are dentists.
Right.
I don't really have a problem with dentists doing injections at all because they're very skilled. My background, as you know, was partly dentistry, so I was a dentist and then I did medicine afterwards. And when I was teaching doctors, dentists and nurses, often the dentists would be the best just because they are used to manipulating the tissues. They're very good. I think for me the most important thing is that they're doing this treatment all the time. So you don't want somebody who is dabbling and, you know, they do maybe a couple of cases a month.
Jack of all trades, master of none.
Yeah, because it's never going to be any good. You really need somebody who's just does consistently this day in, day out, because that is when you will get the best results. Okay guys, so that's it for this week. I hope you enjoyed the video. Thank you so much for joining us again.
Very welcome.
I will link the other half of the video in the comments section below, and I will see you guys again next week. See you later.